I'd like to echo the sentiment and gratitude to our public servants and also express my deep appreciation for all of the staff of the Illinois Department of Human Services and, of course, our 500-some community partners that work with us every day for the people that we serve. Our work requires human connection. We are human services. So like other first responders, most of our staff can't stay at home because they are every day ensuring that Illinois residents have food on their table, shelter, housing supports, and have access to health care, receive psychiatric care, and are safe. And so we have a delicate balance and have to think strategically as we develop and enact safety precautions as our work requires human connection. DHS has a multifaceted plan in motion that is tailored to each type of setting that is under our purview and that factors in our state's access to PPE and other supplies. The governor has shared almost every day that the state is grappling with the federal shortage of PPE. We're working with the governor and IEMA to overcome this the best that we can. We know from the data and experts that our job is to flatten the curve. We know that our DHS population of patients and residents may be affected by COVID-19 more than the general population because of their underlying medical conditions. We are taking every precaution to ensure that we anticipate and care for those individuals in our system who may become very ill. Nevertheless, we know that these cases are agonizing for families and for our staff, and we will continue to be as responsive and transparent as possible for everyone involved. When the crisis hit, DHS immediately created an infection control team that has guided us and advised us through all of our efforts in every setting. With this team and guidance from CDC, IDPH, and IEMA, we have used science and data to influence our actions. Our 14 24/7 facilities across the state serve about 3,400 people a day, with about 6,500 staff who come to work every day. On March 12th, we took the forthcoming actions. We initiated health screenings, including temperature checks for all staff at every shift change and sending staff home for fever or any other COVID-related symptoms. We halted non-essential visits to our facilities. All group activities or community off-campus outings were canceled. All residents' vitals were taken in the morning as well as in afternoon shifts. Continual training of staff regarding sanitation and hand washing has been ongoing. We've provided PPE following the guidance from IDPH and the Centers for Disease Control and Prevention. We've enhanced cleaning on frequently touched surfaces such as doors, handrails, and light switches. Individuals who exhibit signs and symptoms of COVID-19 are placed in isolation immediately. In addition to the meticulous tracking of residents, we are tracking every day the utilization of PPE supplies and what is available down to the individual glove at every facility. Our 124 public-facing local offices across the state generally serve millions of people each day. To ensure the safety of our clients and our staff, we've been quickly building capacity online, and we have, over the course of the past several weeks, migrated staff to work from home to the greatest extent possible to comply with social distancing guidelines for their health as well as the safety of our customers simultaneously. This past Monday, we closed all but 13 public-facing offices and urged people to stay at home and to access services online and by phone. We made the hard decision to keep these few public-facing offices open so that community members had at least some in-person opportunities to meet with our caseworkers. What we've done to keep our caseworkers safe when possible, we've installed plexiglass barriers between community members and staff, made hand sanitizers as well as PPE when possible, and engaged in deep and frequent cleaning of these offices. Simultaneously, as the governor had mentioned, our case volume for these public offices has skyrocketed this past week by more than 170%. It is clear that the needs for people in Illinois has increased dramatically. And so we continue to urge you to apply for these important services online. www.dhs.illinois.gov #HelpIsHere. Our 500-plus community providers across the state provide critical supports and services as well. We have sent over 35 guidances over the past several months because we know now more than ever that communication and clarity is key. We've increased flexibility in funding and programming and are enabling our community providers to tailor their services for the areas of their greatest need. So in closing, I want to reiterate the following. As other first responders and essential operations have, DHS has a delicate balance and has to think strategically as it develops and enacts safety precautions as our work requires human connection. We have a multifaceted data and science-informed plan in motion that is tailored to each type of setting that is under our purview and that factors in our state's access to PPE and our other supplies. And we try to do all of this, as we do every day, with compassion and care. Thank you very much. Governor?